presentation will discuss cardiac arrhythmias, its cardiac complications, and how echocardiography can make a difference. An irregular heartbeat is called an arrhythmia. A normal heart rate is between 50 and 100 beats per minute. Arrhythmias can occur with a normal heart rate, a slow heart rate, or a rapid heart rate. Each year, more than 850,000 people are hospitalized for cardiac arrhythmias. A healthy heart has a regular beat. The beating of the heart is controlled by an electrical system in the body that sends electrical signals throughout the heart. The normal electrical signal begins in the right atrium. It starts in a group of tissue known as the sinus node. The SA node starts the actual heartbeat. It sets the speed and the rhythm of your heart and is known as a natural pacemaker. This electrical activity spreads through the sinus node, through the atria, and eventually into the ventricles, causing them all to contract. As you can see in this video, the electrical signal must have been disrupted, therefore making a problem with the electrical system. This is commonly known as an arrhythmia. If the electrical system of your heart is diseased, injured, or not developed, you may have an arrhythmia. Cardiac arrhythmias may be assessed by the use of echocardiography. An echocardiogram will be performed to assess if an arrhythmia is present, especially after being seen on an ECG. It is essential for an echocardiographer to be able to determine whether an echocardiogram is showing a normal sinus rhythm or any type of arrhythmia. Atrial fibrillation, also known as AFib, is the most common arrhythmia affecting 2.2 million people worldwide. When atrial fibrillation is present, structural irregularities arise due to the dilation of the atria. The dilation of the atria in the heart causes a rise in the intracardiac pressure. Echocardiography and 2- and 3-dimensional imaging, along with a complete Doppler assessment of each valve, is advised for all clinical studies with AFib. An echocardiogram aims to reveal the underlying cause of AFib. The assessment of the left ventricle function and volume is critical. Different modalities in echocardiography allow for optimal assessment of function. M-mode, color M-mode, TDI, color Doppler, and CW wave Doppler are all modalities which allow for ideal assessment of diastolic function and pressures. Assessing the cardiac function of patients with AFib, a complete echo must be performed. All dimensions of all chambers must be quantified for, along with the thickness of all cardiac walls. The mitral, tricuspid, pulmonic, and aortic function must also be assessed. When a sonographer has previous knowledge that a patient has previously been diagnosed with AFib, they will make sure to take closer detailed observation of the left atrial size, the LV wall thickness, and the LV function. Abnormalities in these standard protocol assessments show concrete evidence of AFib to reassure cardiologists of existing disease. Patients suffering from atrial fibrillation can form blood clots that occur in the left atrial appendage. This is a very common site of occurrence in AFib patients. This is where echocardiograms come into play when assessing such complications. Some people live for years with AFib without any problems. However, usually if not properly treated, AFib can lead to some serious problems. Blood clots can form in the left atrium, and if they dislodge, can go into the brain, cutting off circulation, which will cause a stroke. If a clot develops in the appendage and is pumped out of the heart, it then travels to the brain, and this results in a stroke. People with AFib are 5 to 7 times more likely to have a stroke than the general population. Seeing that heart failure and stroke are the biggest complications of cardiac arrhythmias, it is important to know the signs and symptoms to indicate when someone may be in AFib. Some symptoms may include irregular or accelerated heartbeats, shortness of breath, especially during physical efforts, physical tiredness, lightheadedness, fainting, chest pain, and discomfort. Fortunately, with today's technology and continuing research, there are treatment strategies for atrial fibrillation that help prevent worsening conditions such as heart failure and stroke. The primary goal of treating arrhythmias is to prevent a thrombus or embolism from forming. This will help manage the length and quality of a patient's life living with cardiac arrhythmias. Depending on the severity of the arrhythmia, the primary treatment for a patient would be to provide medication. Common medication used in AFib patients are rate control medications. Rate control medications physically slow the heart rate down by blocking unwanted electrical signals in the atrium. Typical rate control medications can include beta blockers or even calcium channel blockers. If these methods do not work, usually an antiarrhythmic drug is used. These drugs are used to control the rate after medication does not work. They try to restore your heart's normal sinus rhythm. Severity plays a large role in patients with AFib. Electrical cardioversion is a procedure where electrical shock waves are used to reset the heart back to normal sinus rhythm. Depending on how long and how severe the patient is with AFib, electrical cardioversion may be performed immediately. However, if the arrhythmia has been occurring for an unknown amount of time, it actually may be dangerous to perform a cardioversion due to the increased risk of stroke. Having patients that are hard to diagnose arrhythmias and cardiac complications is a very important job for an echocardiographer to carry out. If the echocardiographer is not careful and patient enough to not only find out what is actually wrong, but also to understand why it is happening, the echocardiographer could miss something life-threatening. It is critical to capture the most important pictures and clips that actually prove what you are trying to show to the cardiologist. And it is also imperative to understand why what is happening is actually happening. After researching arrhythmias and cardiac complications, it reiterates the importance of the role of echocardiography. It is a non-invasive, non-radiating tool used to assess the structure and function of the heart. As an echocardiographer in training, I have grown passionate about the field of echo.